Minister, first of all, let me welcome you to the House again. I am grateful to have the opportunity to address you and my colleagues on the matter of such grave importance. There is surely not a family in this country that is not affected by the issues of mental health disorder, dementia or intellectual disability. Mental health is an often overlooked and neglected aspect of healthcare in this country. Our history is not an enviable one in this regard. To our shame, this failure is not merely a feature of our history, it continues right up to the present day. Mental health continues to be the poor relation of other areas of healthcare in terms of investment in services and treatment. The societal stigma associated with these issues, born out of ignorance, must be dispelled and consigned to history. To our shame, we still do not allocate adequate resources to provide much-needed mental health services. It is recommended internationally that about 16% or 1/6 of health expenditure should be spent on mental health. Yet in Ireland we spend less than 5%, yet many studies show that we have a higher prevalence of mental health problems than other developed nations. In 2018, Health at a Glance report shows Ireland as having the third highest rates of mental health illness out of 36 countries surveyed. It estimates the cost of our mental health crisis at over €8.2 billion annually. This is not just an economic abstraction. This is a human cost too. Behind the cost to the economy and the health systems is a story of personal pain, suffering, distress, anxiety, loneliness, addiction, homelessness, suicide, grief, death and tragedy, missed education and employment opportunities, unfulfilled potential, lives not lived. For anyone with any insight or an ounce of compassion, it is truly an awful vista. The number of psychiatrists that we have per capita is at the bottom of the international league tables. If any of this is grossly inaccurate, I would be very grateful to hear the Minister go on record to advise this House otherwise. Sorry, I'm skipping on because I didn't realise I had only a few moments to speak. On a more personal note, I would ask the Minister to look at the issue of funerals and bereavements and the effect that is having on the health of those left behind. Many of those of us have people that have passed away with COVID-19, and many of the people that are passing away are in their 70s, 80s and 90s. Religion and faith played a significant role in their daily lives. Many of these elderly would have gone to Mass daily, and that communal worship was taken away from them. Country churches each morning may only have 10 to 15 people congregating for that most important aspect of their lives. The funeral numbers at this time is 10 people. Many families of that generation passing away may have in fact 6 and right up to 10 to 12 children. And how do they choose who goes to funerals? People are getting left out, sons-in-laws, daughters-in-laws, brothers and sisters, grandchildren and so on. And that is the effect that funerals are having on the lives of those left behind. And that is cruel. These churches are extremely suitable for social distancing. To take away that elderly faith from them, to not having access to priests at anointing them before death is wrong. I've heard horror stories. I was very fortunate, but there are many people that are not. How sometimes these diseased bodies have not been dressed and to be put into a body bag with their hospital ground. I've heard of families who literally had their loved one brought straight to the grave and not have had the funeral mass. How uncompassionate is that we are showing to the elderly? So, Minister, can I ask you to look at funerals, please, and how we do bereavement in this country? Ireland, in fact, surpasses anywhere else in the world when it comes to a person dying in our community. The government has robbed these families of that support in their time of grief. This is inhumane to stop people showing solidarity with grieving families. Surely we can find a safer, logistical way to conduct funerals to support families in grief. And thank you, Minister, for that.